week in the pandemic, there are some encouraging signs from parts of the nation. NBC's Susan McGinnis has details.
As America enters the most critical and deadly week for coronavirus yet, the U.S. death toll tops 10,000. Hospitals brace for an avalanche of new cases and deaths.
We're going to have a rough week. We're going to have maybe a little more than a week.
British Prime Minister Boris Johnson admitted to intensive care.
Americans are all praying for his recovery. He's been a really good friend.
But the president combative when asked about an inspector general's report about shortages at hospitals.
What's his name?
It came from the inspector general's
what's his
report.
Name?
I don't know his name.
Well, tell me his name. Let me know. Okay.
The president also brushing off criticism about the continued unavailability of tests.
We're the federal government. We're not supposed to stand on street corners doing testing.
Amid concerns about how deadly these next 2 weeks may be, traces of optimism. Washington state returning hundreds of ventilators to the national stockpile as new cases drop. New York Governor Andrew Cuomo announcing a drop in hospitalizations and ICU admissions, but insisting New Yorkers must remain diligent in social distancing.
This is an enemy that we have underestimated from day one.
From the White House, concern.
It is on us, as a member of this community, of this country, to do everything possible to save one another.
On Wall Street, stocks surged on promising signs that death rates are leveling off. Amid word the White House and Congress are already discussing a new round of direct payments to Americans struggling in this national crisis. Susan McGinnis, NBC News, Washington.
Despite a staggering death toll, the virus is showing signs of leveling off in the New York area. But with states' hospitals overwhelmed, Governor Andrew Cuomo is warning everyone to stay vigilant and stay inside to avoid another spike in cases. NBC's Gabe Gutierrez is in New York.
In New York, nurses are reaching their limits. The U.S. military is deployed throughout the city, and the 2,500-bed Javits Convention Center is now the largest hospital in the country. But authorities say there could be a glimmer of hope. While deaths in New York State continue to rise, the increase has slowed over the last 2 days.
And again, would suggest a possible flattening of the curve.
Daily hospitalizations and intubations are also down.
We are plateauing. We are plateauing at a very high level. And there's tremendous stress on the healthcare system.
Governor Andrew Cuomo is warning New Yorkers not to let their guard down, doubling the fine for not social distancing to $1,000. He said President Trump agreed to his request that coronavirus patients be treated on the USNS Comfort.
It's a marathon, not a sprint, and we're just, not at halftime yet.
Dr. Dara Cass from Columbia University Medical Center had the virus and has now been declared safe to return to work.
I went back into the ER empowered to go hold hands. That was all I wanted to do, because I wanted to hold hands with patients.
Funeral homes are overrun. This one in Brooklyn says it's running out of body bags.
We're overwhelmed. My staff they're on wit's end. They're sleep deprived. They're trying their best.
At St. Barnabas Hospital in the Bronx,
some people didn't make it today.
Dr. Ernie Patty shared with us this video at the end of a particularly grueling shift.
And I guess that's just, we did our best. That's all I can say. It's not been a good day. Really horrible.
Among the lives lost, Father Giacchino Basile, the Catholic Bishop of Brooklyn, called him small in stature, but mighty in energy. Mary Roman was not just a former city clerk in Connecticut. She was a senior Olympian who set shot put records and had survived polio.
She's a fighter, but in the end, this virus is nothing to play around with. It's a serious matter. And I just got the best of her. But he didn't get her without a fight. I can guarantee you that.
New York City officials are considering chilling contingency plans, including temporarily burying some of the dead if morgues are full. Authorities hope it doesn't come to that, Philip.
Let's hope it doesn't. Gabe, thank you.
From New York to across the pond in the UK, where Prime Minister Boris Johnson's fight against the coronavirus has taken a concerning turn. The 55-year-old is now being treated in the ICU in a London hospital after the virus symptoms worsened. NBC's Ali Ruzi live in London for us outside that hospital caring for the Prime Minister. And Ali, do we know Prime Minister's condition at this hour?
We don't know his condition at this hour. We haven't been updated. The last we heard was that he was taken to the ICU unit last night at about 7 o'clock local time. He was given oxygen to assist with his breathing, and we were told that he was taken to the intensive care unit as a precautionary measure in case he needed ventilation. Now, there's no word has come through whether he has been put on a ventilator. We are hearing reports that his condition remains the same. It hasn't gotten better or worse as far as we know. So we're waiting to hear what the doctors and what his team has to say about this. But this is a very dramatic turn in events in this country. Up until a few days ago, we were continually being told that the Prime Minister is in charge, that he is on point of call. That clearly has now changed, that he is in the ICU unit. He felt it necessary to appoint his Foreign Secretary as his deputy in case things get worse. The last time we saw the Prime Minister, Corey, was on Thursday evening when he was outside 10 Downing Street clapping for the NHS workers along with the rest of the country. Now he's in that hospital being looked after by those same NHS workers.
Really trying to show, as positively as he can, that he is in good spirits. But I know that this was a surprising turn. Ali, thank you.
Now to a squabble in the Situation Room. President Trump has been aggressively supporting an anti-malaria drug known as hydroxychloroquine. It's a drug that has the medical community divided. Tom Costello takes a closer look.
Inside the White House, NBC News has confirmed a heated weekend exchange. Presidential advisor Peter Navarro facing off against infectious disease expert Dr. Anthony Fauci. Navarro pushing hydroxychloroquine for treating COVID-19 patients based on anecdotal studies overseas. Fauci saying those studies are not scientific, and chloroquine, a drug used to treat malaria and lupus, also carries cardiovascular risks. But the president continues to endorse the drug.
I would love to go to a laboratory and spend a couple of years testing something. We don't have time. We don't have 2 hours because there are people dying right now.
New Jersey nurse Margaret Novins believes chloroquine and an antibiotic combination helped her recover from COVID-19.
Within 24 hours, my fever was gone. I was still short of breath. I still had to recover from that.
New York hospitals are using it in emergencies, but the governor is cautious.
Anecdotally, you'll get suggestions that it has been effective, but we don't have any official data yet.
Meanwhile, an Inspector General watchdog report has found hospitals nationwide reporting dire shortages of critical equipment, including testing kits, thermometers, and personal protection equipment, and receiving government supplies that expired a decade ago.
We heard an incredible plea from the hospitals about their efforts to keep staff safe.
And amid a widespread shortage of ventilators, a potential shortage of the drugs used to place patients into comas for intubation.
These drugs are crucial to ventilators working and the patients being able to recover and beat COVID-19.
Now pharmaceutical companies are ramping up production of those drugs in light of crushing demand. Philip?
Patients desperate for anything that will work. Tom, thank you.
All right, let's get your first look at today's weather with NBC meteorologist Janessa Webb. Janessa, good morning.
Hey, good morning. We're setting up to see a stormy pattern across the Midwest and Northeast. Not all of the Northeast will be impacted by this first wave of rain. Washington, D.C., all the way into the Cleveland area. We're going to continue to watch the potential of these storms starting to spark up. This morning, you can see some isolated showers currently making their way through across the Chicago area. Currently, 42 million under that severe weather risk from Columbus all the way to Washington, D.C. New York City to Boston as well. I think we'll see isolated moisture, but we're really going to luck out on that severe weather potential. That's a look at the big weather story today. Here's a closer look at your day ahead. And this is all due to a warm front. Look at daytime highs are well above the normal. St. Louis almost at 80 degrees this afternoon across the Ohio Valley. You'll see the storm sparking up all the way into your evening hours. So this is that first wave. We have another wave coming for tomorrow. About that coming up.
All right, Janessa, thank you. In today's Quick Hits, Little Caesars announced it will donate 1 million pizzas to healthcare workers and first responders on the front lines. And Domino's is planning to donate 10 million slices of pizza to help keep communities fed.
Actor Matthew McConaughey made a surprise virtual visit to a senior living facility.